Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing 20 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 193. As with previous cases, most have connections to travel or a known case. In fact, 91% of them do. But we do have one confirmed case of community transmission, and in the other 9% of our cases, we're still involved in the follow-up, and some of them look like they may have community exposure. This is not a surprise to us. We know we are going to see more community exposure as this event evolves. 5 individuals are currently in hospital, and I'm pleased to report that 16 individuals have now recovered and considered to be resolved of their COVID-19. To date, we've had 7,446 Nova Scotians tested who've gotten negative results, which I see that as good news. We've greatly expanded our testing. We're testing a lot more people, looking for evidence of community spread, and the vast majority is we're still getting back negative tests. Again, I want to thank my colleagues in the QE2 microbiology lab, their work to make sure that we have the necessary lab capacity. The last 24 hours, they did over 800 tests, and they are prepared to move to a 24/7 operation if and when necessary. I want to just make sure people are aware that the Nova Scotia Health Authority, Northern Zone, issued a release today communicating to people about a possible exposure to COVID-19. So anybody who was at the Eagles Funeral Home in Westville or the Alma Fire Hall on Sunday, March the 15th, may have been exposed to COVID-19. There was an individual there who was at those events before they became symptomatic and tested positive for COVID-19. But Public Health now has started to do contact tracing and for people in the 48 hours before they become symptomatic, knowing that there may be some risk of transmission of the virus during that 48-hour period. So anybody who was at those events may have been exposed. We know the 14-day period in which they could have developed illness is now over. So we're asking that people who were at those events and did develop fever or cough in the 14 days after Sunday, March the 15th, that they call 811 and to talk to them and arrange a testing. As I talked about yesterday, we're developing an online map which breaks down the data on our COVID-19 cases. That map is now available online through our website, novascotia.ca/coronavirus. It shows that it breaks it down by health zone, and we have 118 of our cases are in central zone, which includes HRM, which is a significant portion of our population, so that makes sense. We've had 32 cases in western zone, 22 in northern zone, and 21 in eastern zone. The message there really is that we have cases across the province that anybody and any community needs to understand that there's the potential for COVID-19 in their community. We all need to practice the prevention measures of good hygiene, staying home as much as possible, essential shopping only getting together in groups of 5 or less if that's necessary, and staying if we're out and about, staying apart 6 feet apart. All those are critically important, along with self-isolating if you're required to, maintaining that strict self-isolation for 14 days. All this is how we're going to have the necessary impact in the weeks ahead to minimize the impact of COVID-19, slow down the spread, decrease the peak that is coming, and be able to deal with this in our healthcare system. It's also how, frankly, we'll get out of this as quickly as possible by all sticking with those strict public health measures now. Along with geography, the map also includes a breakdown by gender. 51% of our cases are males and 49 females. 70% of the cases are between the ages of 20 and 64. So that map that is now up there, that'll be updated daily as part of our online information on COVID-19. I'll finish off by saying I get a lot of communication about a whole range of issues related to COVID-19. In the last few days, I've had a number of concerns raised around people working in banks. We have had banks kept open because they are an essential service. People need to continue to do their banking. Banks are running their operations while respecting the rules around social distancing and number of people. But I would ask Nova Scotians, those who can do online or telephone banking, helps prevent exposure, limiting numbers of people in banks. There are some Nova Scotians who don't have that as an option. If you're going to an ATM to get cash, please use common sense and respect the rules. If there's somebody ahead of you, stay outside. Make sure we're maintaining the 6 feet of social distancing, and not getting groups of people together. Stay 6 feet apart, wait your turn, wait outside, and then go in and use the next ATM. Don't everybody crowd inside the vestibule. Again, just use some common sense. It's a really good idea. Wash your hands before and after you use the ATM. That's really important. I'll finish by making a comment on masks. That question was raised yesterday. There is some growing evidence potentially of the value of just having the general population use masks. There are both potential benefits and risks from that, and the Public Health Agency of Canada is doing an active review of the evidence on that. That'll be being brought forward to the Chief Medical Officers of Health Special Advisory Committee table.